Welcome to the UCLA Fielding School of Public Health 2021 Commencement Celebration. I'm Ron Brookmeyer, Dean of the UCLA Fielding School. I'm honored to be with all of you today to commemorate this momentous occasion in our graduates' lives. Although COVID-19 has prevented us from all gathering together in person, it's my hope for each of our graduates that you're able to connect with someone today who is special to you. Very few of us reach a milestone like this without help. And so, let me begin by welcoming our graduates' loved ones. If you are a parent, partner, child, grandparent, spouse, friend, sibling, or other cherished member of our graduates' lives, I'd like to thank you for your support of our students over the years and for joining us today. It's incredibly meaningful to have you with us. I also want to acknowledge our dedicated faculty and staff who, despite the many challenges that the pandemic has presented, continue to focus on what's most important at our school, our students. The challenges of the past 18 months have profoundly impacted our graduates. Many of you spent the majority of your time earning your degree with our school remotely, which is not what any of us intended. Yet, you have gracefully managed all of the changes and challenges that have come your way, in addition to your existing academic and personal responsibilities, and you persevered. It is your fortitude and determination, along with the support of your loved ones, that have seen you through and brought you to this moment. COVID-19 has left no stone unturned. It has laid bare our nation's decades-long failure to adequately invest in public health, as well as the extreme inequities of the American healthcare system, and our long overdue reckoning with the structural racism that is baked into the fabric of our country has made clear that we in public health must be more proactive in not just documenting racism's harmful effects, but in dismantling the forces that perpetuate them. We know that so much change is needed, and that change requires hard work and dedication. So when I think of what is necessary for our global community to make it to the other side of the COVID-19 pandemic, what I know for certain is that we are more likely to reach our goal line because of you, our 2021 graduates. There is an innate goodness, a hopefulness to our profession of public health. And there is reason this path resonated with you. There was a moment in your life, in your journey, when you recognized that you wanted to make a meaningful contribution to our world, to make the lives of others better. And on your journey, you found your way to our school, to our community. Not even a global pandemic could slow you down, and now you're ready. Today, you join the ranks of public health professionals, those who start each day working to make change, to make our world healthier, one step at a time. How do we make change? Well, it starts with evidence, data, science. But it certainly doesn't stop there. Making change requires effectively communicating evidence so that people can understand it, make sense of it all. Making change requires authentic collaboration, working hand in hand with communities, working with the public and private sectors to create effective health policies. Making change requires optimism and hope. In recent months, we've seen our public health community work together to deploy one of the largest vaccination campaigns in U.S. history. Now, more than 40% of the U.S. population is fully vaccinated. In the face of a global pandemic and unprecedented odds, public health leaders have done what they have always done: say yes to being an active part of the solution. This requires hope, the understanding that change is possible, and the willingness to put in the hard work to get it done. You, our 2021 graduating class, have the knowledge. You have the passion. You have shown your dedication to hard work. I am certain that every community you are a member of will be stronger, healthier, and more equitable because of you. And although you may venture far, know that you will forever remain a treasured member of our Fielding School community. I wish you success, good health, and boundless joy and happiness along the way. My sincere congratulations to each of you. It is now my absolute pleasure to introduce our 2021 UCLA Fielding School of Public Health commencement speaker, Dr. Elaine Batchlor, CEO of MLK Community Healthcare. As CEO, Dr. Batchlor leads a health system that includes Martin Luther King Jr. Community Hospital, a private safety net hospital, as well as outpatient practices, the MLK Community Medical Group, a fundraising foundation, and community and population health programs located in South Los Angeles. When I think about the incredible ingenuity and formidable resolve of healthcare leaders during COVID-19, Dr. Batchlor immediately comes to mind. In the face of daunting odds, Dr. Batchlor and her team at Martin Luther King Jr. Community Hospital have persevered, serving patients high-quality care with humanity and resolve, and acquiring necessary resources during a time of unprecedented shortages. In fact, Dr. Batchlor was instrumental in the development and startup of the hospital, which opened in 2015 as a private, nonprofit hospital with the mission of improving the health of one of the most underserved communities in the state. A member of the National Academy of Medicine, Dr. Batchlor is board certified in both internal medicine and rheumatology. She is also a UCLA Fielding School alumnus. Dr. Batchlor earned her MPH from our school, and she serves on our school's Board of Advisors. Dr. Batchlor has received numerous awards and accolades over the years for her leadership in healthcare, including the Partners in Care Foundation's Vision and Excellence in Healthcare Leadership Award and the Irvine Foundation Leadership Award, which recognizes innovative, effective leaders whose breakthrough solutions to critical state challenges improve people's lives, create opportunity, and contribute to a better California. I am inspired by Dr. Batchlor's leadership, and I'm so grateful to have her with us today to speak to our graduates. Dr. Batchlor.
Good afternoon, class of 2021. Thank you, Dean Brookmeyer and distinguished faculty, for inviting me to give today's commencement speech. Thank you, students, for your hard work and commitment to your studies during a tumultuous year. Class of 2021, you are graduating during an auspicious moment for public health. Auspicious, you might ask? Hasn't this last year been, in fact, a literal disaster? Hasn't the response to COVID illustrated a public health system hollowed out by neglect and lack of funding? Yes. Didn't that lack of investment make us ill-prepared to confront a horrific pandemic? Again, yes. Hasn't COVID's disproportionate impact on communities of color offered yet another scathing critique of the U.S. health system with its large disparities in funding and access based on race and economic status? Yes, yes, and yes. It is because of the demands of the last year that what we do, what you will do in the future, may matter more than it ever has before. Life as we know it in this and every country in the world has been disrupted, often tragically. Nearly 4 million people have died from COVID worldwide. Nearly 600,000 deaths have occurred in the United States, a toll greater than World War II. Our nation's long history of structural racism made COVID even worse for minority communities. In South Los Angeles, where I work, our Latino and African American patients were devastated by COVID at rates 3 to 4 times greater than whites. I saw multiple members of the same family in my ICU fighting for life because they lived in crowded, multi-generational housing and could not socially distance. I saw essential workers, the bus drivers, grocery store clerks, and delivery people who kept LA going, struggling to breathe because their jobs did not afford them the option of staying home. COVID also hit us hard because South LA suffers from an epidemic of poorly treated chronic illness, and COVID preys on people with pre-existing illnesses. Prevention and disease management could dramatically improve our community's health, but that requires access to doctors and services, the kind of access many of us take for granted. Our community has a significant shortage of doctors because most South LA residents are insured by Medicaid. Medicaid pays pennies on the dollar for care. California has the 3rd lowest Medicaid reimbursement rates in the nation. This is a defining feature of our separate and unequal health system. COVID hurt us not because of who we are in South LA, but because of who we are as a nation. And right now, although hopefully not forever, we are a nation that tolerates medical inequality. This will not be our last pandemic. All of us who practice and study health and communities know this. We know we were not ready for this pandemic. We know that our nation's poorly funded and disjointed approach to public health, with variation from state to state, was a big reason why. Public health has moved from the back burner of public policy to the furnace of the urgent and now. Whether it is COVID or climate change or health equity, the most pressing challenges of this moment and of all our futures are public health challenges. That urgency is an opportunity, one that we should seize. From the perspective of public health, we are at an inflection point of history. And in these battles, you are at the tip of the spear. So today, I want to encourage courageous thinking. I want to ask you to push past the tactical and conventional and reach for a more ambitious vision of who we are and what we can do in the world. I want you to think of yourselves not as supporting players, but as the key protagonists of this nation and this world's future. To do that, you have to be ready to take the difficult, less attractive path. Doing so is, in fact, how I came to be here talking to you today. I've never been content to follow the crowd. Part of this was not by choice. I grew up as an African American girl in a white community where my neighbors wouldn't speak to me. I wasn't permitted to blend in. Part of my unorthodoxy is related to my belief that if you challenge conventional wisdom, if you chart a path based on your ideals and shove your fears aside, great things can happen. Here's how it happened for me. 11 years ago, I took a phone call that changed my life. That call was from a recruiter seeking 7 people to take on a task that few wanted or even thought was possible: to start a high-quality hospital in South Los Angeles. I said yes. I joined that group, the board of what is now MLK Community Healthcare. Within 2 years, I became the CEO. Now, if you're from South Los Angeles, or you know its history, you know why so many people thought I was committing career suicide. South LA, to outsiders at least, seemed to be a place of intractable problems. It had suffered repeated riots, economic depression, social isolation, and all manner of systemic racism, including lack of basic health care. The biggest obstacles to health were structural. The primary reason many felt a new hospital would never succeed in South LA was economic. It was, and still is, a poor community where most people were covered by Medi-Cal. Here's a striking example of how the economics work. Today, in California, an average emergency department visit in Los Angeles earns approximately $2,000 from commercial insurers, $650 from Medicare, and $150 from Medi-Cal. Most doctors cannot sustain a practice on Medi-Cal rates. As a result, the average community has 10 times more doctors than South LA. This condemns underserved communities like South Los Angeles to fewer services, less access, and lower quality health care. It means people are getting medical care in the emergency department when it's already too late, rather than preventive care at a doctor's office. Here's what that structural racism looks like. In South LA, the diabetes rate is 3 times higher than the rest of the state. Life expectancy is 10 years shorter. Easily preventable and manageable health conditions progress to the point of no return due to lack of care. Today at MLK Community Hospital, diabetic amputations are among our most commonly performed procedures. No wonder people thought I was crazy, trying to start a hospital in an area without the resources to sustain quality health care. The obstacles were just too big. So here was my predicament, taking that fateful phone call. I was being asked to help start a hospital in a place that was under-resourced and where the inequality that fostered those conditions was codified in policy and practice. Don't do it, people told me. It won't end well. I didn't listen. Instead, we created a new model, a private hospital built with public support, a rarity in the nation. We used visionary philanthropy to subsidize physician salaries, which means we can pay market rates. And it turns out that when you pay doctors adequately, you find that a lot want to work in areas like ours. They are attracted by the mission. Today, we have doctors from the nation's leading academic centers. We insisted on excellence, including in our state-of-the-art technology, which has made us one of only 6% of hospitals in the nation to achieve HIM-7, the highest level use of health information technology. Since opening in 2015, MLK Community Hospital has changed the way people think about safety net hospitals. It's in the top 10% of hospitals nationwide for patient satisfaction. We've received multiple A grades for patient safety, and we've been called the hospital of the future by Politico. This year, we officially became something else people said couldn't be done: a health system designed to provide community-based prevention and disease management. MLK Community Healthcare now includes a medical group, multiple practice sites, a population health program, integrated behavioral health care, street medicine, and graduate medical education. We're engaged in policy advocacy to back this up. We did it because we didn't listen to the conventional wisdom. We took risks, and you should too. If I was a young professional today, I think I would work on climate change. COVID has shown us how interconnected we are. Like COVID, climate change affects us all. These existential challenges are pressing and big, and they won't be solved without taking risks. There's a natural fear in all of us of taking on what seems to be an impossible task. Why go up against seemingly intractable forces that stand in the way of success? But here's my advice. Take the difficult, less attractive path, because taking on difficult challenges offers amazing opportunities. Hard jobs grow our skills in ways that less challenging career paths don't. Big challenges typically aren't solvable through conventional means. They force us to think outside the box and consider new approaches. They hone our critical thinking skills. This makes us creative and adaptive. The hard job also gives us the opportunity to live our values. Even if you don't reach all of your goals, you will remain faithful to the passion that brought you to healthcare in the first place. I'm a medical doctor who's worked in many different domains: academia, the private sector, health plans, and now a hospital and health system. Every step of the way, I was told that my career would suffer if I made a wrong turn. As far as I can tell, that hasn't happened yet. Given the size of the challenges confronting us, we need more people who are willing to do the things that seem impossible to do. So I leave you with this insight and piece of advice. The job no one else wants is sometimes the job with the most potential. Be alert for opportunities that don't look like opportunities. And when they come along, don't be afraid to say yes. I can't wait to see what happens next for you, class of 2021.
Thank you so much, Dr. Batchlor, for the incredibly important work that you do, for making time to be with us today, and for your inspiring words. Next, we will hear from the co-presidents of the Fielding School's Public Health Student Association, Mara Mata and Nayeli Santos.
Thank you, Dean Brookmeyer. Hello, my name is Mara Mata, your Public Health Student Association co-president for the past year. I am honored to be addressing the class of 2021 graduates, our family and friends, and the UCLA Fielding School of Public Health faculty and staff. Public health is the head-to-toe, inside-out well-being of entire communities. Even before COVID-19, we, the class of 2021, have lived through public health crises. We not only have the pragmatic tools and theoretical frameworks to talk about public health issues, but we have lived them. We have experienced hunger, homelessness, and violence. We come from backgrounds and circumstances that do not typically get graduate degrees. Not for lack of talent or trying, but because we have faced systems designed against us, full of racism, sexism, ableism, and more. To graduate despite those challenges cannot be understated. In short, we are cycle breakers, which is precisely what public health needs. We see the same issues reemerge time and again, like police brutality and systemic poverty. We may even face another pandemic in our lifetime. It is easy to be disheartened at the state of the world and feel like nothing will change. But I look at my classmates, and my faith is restored. We have published op-eds and journal articles, and we started podcasts. We protested, and we petitioned. We supported each other, and have gained not only colleagues, but lifelong friends here. I am proud of us. Regardless of what our next steps are, know that we have changed each other's lives for the better. Thank you. It is my pleasure to pass it on to my co-president of PHSA, Nayeli Santos.
Thank you, Mara. Good afternoon, family, friends, faculty, staff, and 2021 graduates. My name's Nayeli Santos, and I'm greatly honored to be on whichever screen you're watching this ceremony. These past 2 years are ones I'm sure we will never forget and ones we will talk about for many years to come. We all had an idea of what the start or end of our time at FSPH would look like, but none of us could have ever predicted our reality. We were all challenged in many ways and at the same time expected to thrive in our programs. It was not easy, and I'll admit there were days in which I felt like giving up. Yet from all the hardship, we grew and became stronger. And although we didn't actually get to spend much time together, it comforts me to know we finished this together and now take the lessons and knowledge we have gained and apply them to our prospective careers to make a difference in the world. I know it seems cliche to think we will change the world, but as Obama once said, change only happens when ordinary people get involved, get engaged, and come together to demand it. So I challenge all of us to come together wherever we may go, to get involved in our communities, get engaged to learn from them, demand the change we hope to see, and move towards a world in which equity is the makeup of our society. And I know that's a big hope, but the more attainable hope is that our good character is noticed and inspires others to follow by example. FSPH has prepared us well, which is why I am confident that we will be able to accomplish this challenge. As you celebrate today, I wish you a joyous day alongside your loved ones. And as they commemorate you for your hard work, we should also commemorate ourselves for having chosen the field of public health as part of our journeys. Now more than ever, we are needed to help pave a better future for all. Good luck on all your future endeavors, and congratulations, class of 2021.
Thank you, Nayeli and Mara, for your leadership and service to our school community. It's now my pleasure to introduce the UCLA Fielding School of Public Health Student Pledge. Representatives of student groups from across our school recorded the pledge on behalf of their classmates for today's celebration.
We're graduating into a world with growing unrest, violence, and a loss of discourse.
We, as public health practitioners,
should not shy away from the difficult conversations.
No podemos tener la esperanza de abordar la prevención sin reconocer la interconexión de los sistemas y políticas
that have led to the isolation and disempowerment of vulnerable populations.
We must examine whether we are actually changing these systems to be more equitable,
or simply maintaining the status quo.
We should now strive to put at the center of our work
the voices of those most vulnerable.
Debemos esforzarnos por empoderar comunidades.
To place people over profits.
And to understand that our Earth is not a place with infinite resources.
We must strive to create inclusive environments that honor our diversity.
Ya que el futuro continúa siendo incierto.
نحن نواجه أزمات غير معروفة.
We leave this university with the tools and experiences to be brave in raising our voices.
In questioning the status quo.
En desmantelar las estructuras y sistemas que nos dividen.
Y la construcción de coaliciones diversas, impactas y justas.
This is our pledge.
Thank you to all of our graduates for your unwavering commitment to making our communities healthier and more equitable. We will now recognize the UCLA Fielding School of Public Health Class of 2021 Master of Public Health, Master of Science, Doctor of Public Health, and Doctor of Philosophy recipients by academic department. We'll begin with our Department of Biostatistics and it is my pleasure to introduce the chair, Professor Sudipto Banerjee.
Thank you, Dean Brookmeyer. Good afternoon. I am Professor Sudipto Banerjee, Chair of the Department of Biostatistics. It is my pleasure to present to you the Master of Public Health, the Master of Science, the Doctor of Philosophy, and the Doctor of Public Health graduates for the Department of Biostatistics. Congratulations to the class of 2021.
Olivia Goldston. Caitlin Huang. Derek Lee. Brett Young. Ricardo Aguilar. Valentina Aputhasamy. Mingfei Dong. Yilan Huang. Jinyang Li. Andy Liu. Nan Liu. Yutan Liu. Wenlan Pan. Xie Xian. Ami Sheth. Yutong Wu. Naning Xu. Mingjia Yao. Hanyan Yuan. Heng Zheng. Zhiyun Kim, elucidating the genetic architecture of complex traits with variance component models. Douglas Ezra Morrison, statistical challenges in incidence estimation using cross-sectional data and multi-biomarker assay algorithms. Justin Williams, methods for estimating causal effects for multivariate continuous exposure. Wenxi Yu, domain knowledge-assisted methods for a weekly supervised task, automated diagnosis of idiopathic pulmonary fibrosis using high-resolution computed tomography scans. Zhijiao Zhang, using competitive swarm optimizer with mutated agents to find optimal experimental designs.
Thank you, Professor Banerjee. Hello, I'm Professor Mike Prelep, Chair of the Department of Community Health Sciences. It is my pleasure to present to you the Master of Public Health, Master of Science, Doctor of Philosophy, Doctor of Public Health, and Masters of Public Health for Health Professionals graduates for the Department of Community Health Sciences. Congratulations to the class of 2021.
Janan Al-Khaja. Eva Leona Bataya Mann. Carl Bolano. Amy Bui. Laura Caracciolo. Jacqueline Samantha Carranza. Marisela Cervantes. Kathleen Corpus. Hannah Davich. Yareli Escucia Calderon. Marisol Granillo Arce. Brianne Hernandez. Sarah Holmesy. Ava Hosseini. Lacey Howcroft Chappell. Meredith Johnson. Lauren Jones. Nicole Jones. Hanako Justice. Natalie Lopez. Lizzie Lupercio. Trixie Joy de Vera Mansala. Teresa Mata Cervantes. Telma Menendez. Emily Flynn Murray. Elaine Owusu. Kirsten Paulus. Emily Arauda. Shelby Redmond. Andrea Renteria. Ani Rodriguez Viloria. Jessica Salazar. Nana Sarkadiadu. Janice Sito. Nilpa Shah. Leora Sherman. Yoonju Shin. Lucy Stillman. Michelle Thomas. Jessica Twan. Taylor Ward. Clarissa Wong. Tessa Yadagarians. Hallie Young. Shu Hua Ho. Imran Ahmed. Jessica Arzola. Amira Dales. Magda Estrada. Paige Brianna Hall. Christina Jung. Michelle Katz. Austin Kim. Megan Laird. Naomi Lamb. Sean McGivern. Clarence Monteclaro. Kemi Rolay. Whitney Scott. Young Saw. Stephanie Trahan. Blair Tribulski. Apurva Barve, examining the socio-demographic and physical health correlates of psychosocial functioning among Indian men and women, a latent class analysis using WHO SAGE study data 2007 to 2010. Marta J. Bornstein, perceived and experienced infertility, contraceptive use, and reproductive health outcomes in Malawi. Ling Hui Hyang, racial and ethnic disparities in breastfeeding practices and the impact of interventions in a low-income population in Los Angeles County. Shelley Jung, evaluating community-level initiatives to address early childhood obesity in Los Angeles County, an innovative application of machine learning methods to community health research. Grace Kim, effects of a nuclear risk storyline on the popular show Madam Secretary on viewers' knowledge, attitudes, and behaviors. Sarah Roth, do nutrition policies matter? Assessing the determinants of nutritional quality of inventory at food banks. Miranda Westfall, are infant feeding practices associated with early childhood overweight and obesity? A longitudinal study of participants of the Special Supplemental Nutrition Program for women, infants, and children. Natalia Woolley, adolescent bullying and socioeconomic status in Latin America and the Caribbean, an investigation across individual school and policy levels.
Thank you, Professor Prelip. Good afternoon. I'm Professor Shane Q. He, Interim Chair for the Department of Environmental Health Sciences. It is my pleasure to present to you the Master of Public Health, Master of Science, Doctor of Philosophy graduates in the Department of Environmental Health Sciences and the Interdepartmental Graduate Program in Molecular Toxicology. Congratulations to the class of 2021.
Carla Adolphus. Gabriel Albano. Monica Curtin. Lisbeth Diaz. Donna Haydar. Abir Hossein. Ai Huang. Ingrid Otto. Marian Peralta. Angelica Ruiz. Antonio Zapata. Joshua Aaron Cacho. Yuning Guo. Robert Shoup. Susie So. Maureen Sampson. Serotonergic modulation of visual neurons in Drosophila melanogaster.
Thank you, Professor Keehee. I am Professor Karen Michaels, Chair of the Department of Epidemiology. It is my pleasure to present to you the Master of Public Health, Master of Science, Doctor of Philosophy, and Doctor of Public Health graduates for the Department of Epidemiology. Congratulations to the class of 2021.
Lexi Askins. Elizabeth Chen. Yixin Chen. Jean Ann Delgado. Yiwei Ding. Corey Keith. Lamia Khan. Isra Kankadri. Hein Kim. Hesu Kim. Julia Kerber. Natalie Land. Zhanggan Lin. Stephen Ma. Jacqueline Marked Maloney. Victoria Murray. Valerie Pons Rubalcava. Haley Sermayan. Shuyan Tang. Katya Valdez. Yu Ning Yang. Elizabeth Agredano. Noyeli Benitez Santos. Yufan Gong. Yansen Pan. Catherine Saris. Sharia Thompson. Yin Yang Yu. Defne Yilmaz. Kosuke Nue, estimating the effects of diabetes on cardiovascular events and mortality, causal modeling and machine learning. Koshin Jin, hormonal factors in association with lung cancer in Asian women. Usuke Okubo, the effects of changes in health policies on antibiotic and non-antibiotic prescription patterns and healthcare utilization in Japan. Pirom Teng, HIV testing among antenatal care attending pregnant women and male partners in Cambodia. Primary and secondary data analyses including Cambodia Demographic Health Surveys 2005, 2010, and 2014, case control study, and in-depth interview. Chi Yan, metabolomic and epigenomic assessment of air pollution and pesticides exposure in California. Uhui Zhu, dietary intake of nutrients, index-based dietary patterns, genetic predisposition with stomach cancer.
Thank you, Professor Michaels. Good afternoon. I am Professor Jack Needleman, Chair of the Department of Health Policy and Management. It is my pleasure to present to you the Master of Public Health, Master of Science, Doctor of Philosophy, and the Executive Master of Public Health graduates for the Department of Health Policy and Management. Congratulations to the class of 2021.
Zara Abu Khalil. Rifa Akanda. Tam Ao. Neda Awad. Mackenzie Bollinger. Justo Amador Felix Caballero. Lucia Garcia. Janai German. Austin Howley. Brianna Kelly. Peyton Lawton. Marlene Lopez. Naya Manika. Guadalupe Maya Solorio. Jesus Alejandro Medina. Alicia Mehdi. Caitlin Newhouse. Natalie Nguyen. Martin Perez. Rosette Perez. Anushka Rastogi. Paulina Sepulveda. Alexander Soto. Ryan Steppe. Suchi Sundaraman. Ayman Tiem Ula. Corinne Van Groningen. Che Sing Ye. Alex Fowler. Daisuke Furukawa. Teresa Liu. Kimberly Lynch. Erlanda Almendarez. Karen Alvarez. Ashley Anderson. Julia Carafelli. Tiffany Chen. Christopher Chin. Tanya Ferrer. Sarah Freed. Aline Gendelman. Margelena Hernandez. Maya Jolly. Sophia Lee. Jocelyn Lauren. Danielle McLaughlin. Martha Mendoza Orozco. Melissa Moore. Eddie Moreno. Sarah Para. Mackenzie Slade. Ariel Wages. Kathleen Yang. Cherie Blair. Contextualizing risk examining the impact of substance use on HIV transmission dynamics among a cohort of men who have sex with men. Karen Wu, the association between frailty and hemodialysis vascular access fistula and graft failure.
Congratulations to all of our UCLA Fielding School of Public Health new degree holders. Your work in life may take you to unexpected places, but know that the UCLA Fielding School will always be your home. I would like to thank all of the family members, partners, friends, faculty, and staff for supporting our graduates along the way and for joining our virtual celebration today. Congratulations to the UCLA Fielding School of Public Health class of 2021.